ating free school. Mic check. Officials and experts confirm there's now community transmission of the Delta variant in certain parts of the country. Philhealth denies that it is indebted to hospitals by as much as 86 billion pesos. Philippine General Hospital recorded its most number of patients since the onset of the pandemic. And the PBA gets the green light to resume games in Pampanga. Fast, focused, and fearless. Here's everything you need to know as you jumpstart your day. I'm Charles Lejano. Kicking off today's newscast with the health department seeing growing evidence of community transmission of the Delta variant in the country. But they no longer see hard lockdowns as the best option against it. Greg Gregorio tells us why.
The health department has conceded that wide-scale lockdowns are no longer the best way to contain the spread of COVID-19. Health experts believe that granular lockdowns could make more difference.
Mas magiging effective at mas magiging advantageous para po sa ating lahat, magga-granular lockdowns tayo at i-improve po natin yung mga factors dun sa PDITR natin.
The agency reiterates that the public's cooperation is still key, especially amid the threat of the Delta variant. Although it is not yet official, the health department is seeing evidence of the Delta variant community transmission in Metro Manila and Calabarzon.
Nakita natin na wala nang link ang mga kaso sa bawat isa. We are seeing clustering of cases in these two big regions.
On Monday, the Philippine Genome Center tallied 466 additional cases of the highly transmissible variant, bringing the total count of known Delta cases to 1,273. 422 of these are local cases, 14 are returning overseas Filipinos or ROFs, and 10 are still unverified. The DOH reiterates the need to ramp up COVID-19 vaccination. There is also the need to shorten the time frame from case detection to isolation. It currently takes an average of 9 days before a positive case gets isolated, while it takes 12 days in NCR. The DOH wants to trim this down to 6 days. The DOH projects active cases in NCR to hit 66,400 by end August and some 269,000 by end September if the previous 2-week ECQ period would be followed by 4 weeks of modified ECQ. For his part, Dr. Edsel Salvana of the DOH Technical Advisory Group has noted a drop in the percentage of severe and critical cases. The 2.8% cumulative percentage from August 6 has gone down to 1.8% in August 22. Salvana said this is due to the increasing number of people getting vaccinated across the country. For News 5, Greg Gregorio, we are One News.
The health department clarifies that the community transmission of the Delta variant in the country is not yet on a nationwide scale. In an interview with 1PH's sa Totoo Lang, Health Undersecretary Maria Rosario Vergere explained that there are 3 conditions that need to be met to declare this. These are the appearance of a large number of cases, the occurrence of case clusters in multiple areas, and the inability to link cases to known sources of infection. Vergere also said that because of the limitations of genome sequencing in the country, the 3rd condition has yet to be fulfilled.
Sinasabi po ng WHO We cannot pronounce the whole country as having community transmission. Katulad ngayon po, pag tinignan natin, may mga lugar naman po pa rin naman dito sa ating bansa na wala pa rin ganung kadaming kaso, wala pa rin namang clustering of cases. So we are doing this per region at tinitignan po natin ngayon. And as I've said, let us just be proactive. Lahat po tayo dapat isipin, meron ng community transmission at tayo po ay umakto ayon doon.
Some 300 COVID-19 patients are currently admitted at the Philippine General Hospital. PGH spokesperson Jonas Del Rosario says this is the highest number of admitted COVID patients at the hospital since the onset of the pandemic. Del Rosario said they initially had 250 COVID beds allocated for infected individuals. However, they had to add 50 more to cater to the rising number of patients seeking treatment for the coronavirus disease. PGH is also planning to add COVID beds to attend to kids getting infected with COVID-19. Del Rosario added that most of their severe COVID-19 patients are unvaccinated.
Roughly about 70% of the hospitalized patients in PGH are unvaccinated. So it's probably a reflection of the number of people who are unvaccinated in the communities. But what is more important in our data, we also saw that 70% of those who are those who are severe or critically ill, they are in the ICUs. 70% of those are unvaccinated. And about 75% of those who are intubated, meaning on mechanical ventilation, are unvaccinated. So clearly we see the sicker patients, they're unvaccinated, and most of our vaccinated patients, they are moderate to severe, and most of them will recover.
Philhealth beneficiaries fear having to pay for their own expenses in full following a threat from hospitals that they might disengage from the state insurer. Mobile journalist Jacob Lazaro gives us the front seat to the story.
Vicky Lensangan's daughter was recently confined after testing positive for COVID-19. Right now, she depends on Philhealth benefits to lighten the burden.
Up to now, siyempre hindi pa namin alam yung running deal. Baka ma-surprise naman kami. Will it cost us like $1 million or something, or less than $1 million? Whatever amount that Philhealth will shoulder is a big help.
If the row between Philhealth and the country's hospitals isn't resolved, Vicky isn't the only one who will have a problem. All beneficiaries of Philhealth will. The Philippine Medical Association, Philippine Hospital Association, and the Private Hospital Association threatened to disengage from Philhealth after the state health insurer ordered the suspension of payments to hospitals under investigation for possible claim fraud. The threat pushes through, hospitals will not renew accreditation with Philhealth this October. That would mean Philhealth beneficiaries will have to shell out money for their hospitalization.
Kawawa dyan, siyempre, ang ating mga pasyente. Dahil po, ang kanila pang benefits, instead, i-deduct kaagad ng mga ng mga ospital. Ang mangyayari po, i-advance muna ng pasyente at i-refund na lang nila sa PhilHealth.
There are 96 billion Philhealth beneficiaries as of December 2020. And with the current surge of COVID cases, these beneficiaries would have to stand on their own if the process breaks down. Hospital fees and other medicines, medical bills of severe to critical cases can easily reach 1 million pesos or more. Degrano says the hospitals are groaning under the weight of the pandemic, with Philhealth not having paid some 73 billion pesos in unreleased claims to the hospitals.
Po nalulugi ngayon ng ospital dahil malaking bahagi po ng income nila andun sa PhilHealth. Benefits po yon ng mga miyembro na hinohold nila, na hindi nila binabalik sa amin.
Lawmakers and the health department scheduled a dialogue between the two parties in the House of Representatives on Tuesday. So Filipinos like Linsangan don't have to pay the consequences of this conflict. I'm Jacob Lazaro, and we are One News.
Meanwhile, Philhealth is denying that they owe hospitals as much as 86 billion pesos in claims. Spokesperson Shirley Domingo says that figure actually came from Philhealth, but she says they eventually came up with the correct figure after finding out that there was a glitch in their data collection. She added that hospitals should not be counting returned and denied claims towards Philhealth's unpaid obligations.
Kami naman din ang nagbigay ng data na yon, and it was erroneous. And we explained to them kung bakit erroneous yun. And we gave them the corrected data. Inad nila yung mga claims that are in process doon sa offices namin, plus the claims that were returned to hospital, plus the claims that were denied. So, hindi naman tama yon. Para sa kanila, that's their accounts payable. From our point of view, hindi naman dapat isama ang RTH and denied. Because denied is already denied. So, hindi namin payables yun.
It's now a race between the virus and our immune systems, and a booster shot may just be what we need to win. A professor from the La Jolla Institute for Immunology explains this in Bloomberg Quick Take.
The boosters work, and they would definitely help. The boosters, both the Moderna and the Pfizer booster, take antibodies back up to at least where they were, and probably twice or 4 times where they were at the peak. It's definitely teaching your immune system to recognize Delta better. The antibodies that people are making after a booster, they are better antibodies. And they're also probably then better antibodies at recognizing other variants in the future. If you get infected once, your immune system says, all right, here's how much I want to set aside of memory, right, to not get that again. You get infected twice, your immune system says, well, that didn't work, right? It should probably up that some. You get infected 3 times, immune system like, all right, this is a problem. It's really worth not getting sick anymore. And so the vaccines are essentially that, right? And if the immune memory was pretty good after the second one, what's probably going to happen after the third one is that it's going to be more stable. Even if the peak is the same, you're going to keep more of it for a longer period of time. It's a race, right? It's a race between the virus and your immune system.
The PBA is officially on again after securing formal clearance from the Pampanga LGU to resume the shelved 46th Philippine Cup. Commissioner Willie Marshall said Pampanga Governor Dennis Pineda gave the official go-ahead for a semi-bubble setup after an initial verbal agreement last week. The PBA is eyeing to resume hostilities as early as next week, but has yet to announce an official start date. Marshall said teams will be given at least a week of practice to regain their footing before picking up almost midway through the elimination round. And that's how the day is shaping up to be. Join us again later at 10 a.m. as we monitor the day's biggest stories from sunrise to sundown. You can also catch One News on Signal Play. Register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.